www.healthcmi.com. Acupuncture Continuing Education Online. Today in the news. Acupuncture will be included in all Maryland and California small group and individual health insurance plans beginning in 2014. The Patient Protection and Affordable Care Act, also known as Obamacare, outlines 10 essential health benefits. The essential health care benefits are broadly defined by the federal government, and the feds have left it up to the states to determine the exact regulations behind those essential health benefits. So it's the states that ultimately determine the true meaning of Obamacare. Let's take a look at what the federal government has stated are the essential health benefits. They say ambulatory services, emergency care, hospitalization, maternity and newborn care, mental health and substance abuse care, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventative and wellness care, and chronic disease management, also pediatric care. Maryland and California quickly picked up on this and defined the true meaning of essential health benefits in their states and included acupuncture as part of those packages. Maryland's Lieutenant Governor Anthony G. Brown recently presided over the Maryland Healthcare Reform Coordinating Council in Annapolis. The council, charged with defining essential health benefits, chose from among 10 existing insurance plans already available in the state of Maryland. The benchmark plan chosen was one already provided to state workers. The plan includes acupuncture for pain management as part of the preventative and wellness care essential healthcare benefit. Governor Jerry Brown of California recently signed healthcare legislation authored by Assemblymember Bill Monning. The new law sets baseline benchmarks for essential health benefits to an existing Kaiser Permanente health insurance plan. The Kaiser plan includes acupuncture for the treatment of pain and nausea. So again, what these states have done is taken existing healthcare plans that are working for insurance companies and for patients and just setting a baseline standard of this is what should be in a standard package. You should have an ambulance be able to pick you up. If you show up and get surgery in an emergency, you should get some surgery. You should get some rehabilitative services should you need them. If you have prescription drugs, if you need them, they'll be covered. If you need laboratory services, they're going to get to you. There's newborn care, pediatric care, chronic disease management, and preventative care. These are the kinds of things they're building into a package and simply choosing from among existing insurance plans that seem to be functioning within their states and going with them. So again, in California, they've chosen the Kaiser Permanente plan. Under the new federal law, medical treatment limitations can be no greater than those adopted by the plans from the states. So, as a result, there is no cap on the annual number of acupuncture treatments allowed to patients in California because the Kaiser plan does not include this limitation. However, it is left to insurance companies to decide copays, deductibles, referral requirements, and physician networks. Some federal restrictions do apply to cost sharing and actuarial value, meaning there will be some limitations on how far insurance company can push up deductibles and copays. These restrictions are intended to make health insurance plans more affordable. So let's see how it all pans out, but it does look like Maryland and California are going to pick up a bit of acupuncture care as preventative health care. Ultimately, it's up to the insurance companies what it will cost, but there are limitations in the federal law and how far they can go with charging for these expenses. Also included in the federal legislation as essential healthcare benefits are tobacco cessation programs and vision screening programs. These laws apply to individual health insurance policies and small group policies. Well, what exactly is that? Well, individual policies are basically one an individual goes out and buys for themselves or their families. And these are definitely ones included in both HMOs and PPOs. Small group policies are a little different. Right now, small group policies are technically 50 or less employees. However, in 2016, the definition of a small group policy changes, and that will be 100 or less employees in a small group policy. So In 2014, it'll kick in for companies with 50 or less. And then 2016, it will kick in for companies with 100 or less. It's important to note that these plans, although they start kicking in 2014, won't apply until someone has either received a new insurance policy or renewed their existing policy. So there is a renewal period, and as your policy turns over and is renewed, then the new rules and regulations will apply, and these benefits will kick in. Given the amount of research showing that acupuncture is not only effective, but cost effective, we expect to see reductions in the cost of delivering health care as a result of providing acupuncture as a service. This is reminiscent of the time that Blue Cross did a series of cutbacks years ago in providing health care. They upped deductibles, they upped co-pays, they cut back on services. And at the time, they were only providing 12 acupuncture visits per year. However, they upped that to 24 acupuncture visits per year as part of the cutback. When questioned about how can going from 12 visits a year to 24 visits a year as a standard of care be a cutback, they cited that their studies show that if their acupuncture patients, that the acupuncture patients actually cost them less than those who do not get acupuncture. Therefore, they are encouraging acupuncture as a cost reduction measure. And this does explain for a lot of the popularity and acceptance of acupuncture within the insurance industry. Well, that's it for the news today. Thank you for listening. www.healthcmi.com